evening, everyone, and thank you for joining our Men's Health webinar. We'll start with a few housekeeping items, and then I'll introduce tonight's speakers. First, your participation in tonight's webinar is completely anonymous to other attendees. No one can see your face or your name, and any comments or questions can only be seen by myself and our speakers. If you wish to ask a question, please type it in the chat box at the lower part of your screen, and we will have a Q&A portion at the end of the presentation to address these questions. Our presentation tonight will last for approximately 1 hour and will be presented by Dr. Jason Kovac and Dr. Alex Tatum of Urology of Indiana. Dr. Kovac obtained his Master's of Science degree from Queen's University in Kingston, Ontario, Canada, followed by his medical and PhD degrees from the University of Western Ontario in London, Ontario, Canada. He is fellowship trained in infertility, andrology, and sexual medicine from Baylor College of Medicine in Houston, Texas. Dr. Tatum graduated from the University of Georgia in Athens, Georgia with his BS degree in biochemistry and molecular biology, followed by his medical degree from the Medical College of Georgia in Augusta, Georgia. He then completed his internship in general surgery, followed by his residency in urology at Indiana University in Indianapolis, Indiana. Lastly, completing a fellowship in male fertility, microsurgery, and sexual medicine at Baylor College of Medicine in Houston, Texas. Thank you for joining us tonight, and I'll turn it over to Dr. Kovac to get us started.
Hello there, everybody. Thanks so much for joining us today. I'm going to open it up by starting to talk about erectile dysfunction. The goal is to understand your treatment options, as well as to give you a little bit of a background surrounding the notion of erectile function, as well as the prevalence of erectile dysfunction. So what is erectile dysfunction? It is a persistent inability to achieve or maintain an erection firm enough to have sexual intercourse. In essence, you are not the only one. There are many, many millions of people, billions of men who are affected by this condition. So what's involved in the process of getting an erection? So when aroused, the nerves surrounding the penis become active, muscles around the arteries then relax to allow more blood flow into the penis. So essentially it's a relaxation effect. So the blood is then flowing in. The additional blood then makes the penis stiff and hard or erect. The erection then tightens the veins that enable the blood to remain in the penis and to keep it erect. Erectile dysfunction can have a broad impact on the health-related quality of life. So there's numerous roles which are involved in this triad. So what are the causes and comorbidities associated with erectile dysfunction? Number one, the top 3 physical causes of erectile dysfunction include vascular conditions, diabetes, as well as medication-induced erectile dysfunction. It can be the result of or a precursor to prostate cancer therapy, diabetes, or heart disease. So there's many patients that come in to see us and they present with erectile dysfunction. And if they're younger, I actually like to do a blood sugar because a lot of these guys haven't been to their family doctors for a long period of time. So we check the blood sugar and we've actually diagnosed numerous people with diabetes as a presenting factor of their erectile dysfunction. The advantage of this is the earlier you get it under control, the better you have chances to improve your erectile function afterwards. So what's the connection there? So 15 million men in the US have diabetes. 1 in 2 men with diabetes have sexual troubles that are caused by their disease. And indeed, in men with diabetes, erectile dysfunction is more severe and associated with a poor quality of life. And erectile dysfunction can occur about 10 to 15 years earlier in men with diabetes. That's why I tend to check them even when they come in, they're age 30, 35, 40. We're still checking these guys for blood sugars. Erectile dysfunction is less responsive to oral treatments in men with diabetes. And exactly what I was saying, in some patients, erectile dysfunction can be the presenting symptom of diabetes. So the other thing that erectile dysfunction is often associated with is the notion of cardiovascular issues. So typically it can present before the symptoms of heart disease. So essentially the arteries supplying the penis are smaller than those that are supplying the heart. So blockage of these arteries can then cause a reduction in the blood flow, which will usually affect these smaller arteries before symptoms of heart disease can develop. So you can see on this little figure here, you have the first one on the left, erectile dysfunction, looking at the penile artery. We've got essentially size of 1 to 2 millimeters, no matter how big your penis is. And then you talk about leg pain while walking, you're looking at the femoral artery all the way on the right side. That's about 6 to 8 millimeters. So you can see how if plaque begins to develop along the inside of those arteries, you're going to get blockage in the smaller arteries before you're going to get blockage in the larger arteries. So that's why they talk about this kind of canary in a coal mine of erectile dysfunction. So people will come in exhibiting signs, exhibiting erectile dysfunction, and it's always helpful to begin the process of working up whether they have any kind of cardiovascular issues that are contributing to this. And it presents a little bit earlier, thus allowing us to intervene a little bit earlier. Erectile dysfunction can result from prostate cancer therapy as well. So the nerves that provide stimulation for erections actually lie very close to the prostate, and these can be injured during prostate cancer therapy. Prostate cancer treatments can affect a man's ability to get an erection on a temporary or permanent basis. So a lot of times, even if men have no issues prior to prostate cancer therapy, they can develop erectile dysfunction following prostate cancer therapy. And one of the things that we've worked on at our Men's Health Center is a program which would allow men undergoing prostate cancer therapy to be preemptively treated and helped to keep their erections moving forward during therapy as well as after therapy, to allow it to give themselves a better chance at maintaining their erectile function. Overall, erectile dysfunction affects 25 to 75% of men. It's a large range. Erectile dysfunction as a result of prostate cancer surgery, when you take those men into consideration, anywhere between 10 to 50% of men 1 year after surgery had trouble with their erection. And this is not only with regards to surgery, it's also with regards to erections. So 50% of men who have radiation for prostate cancer will also have difficulties with erections post-therapy. Peyronie's disease is a different type of complication that we also deal with at our Men's Health Center. Peyronie's disease is the development of fibrous scar tissue inside the penis that can then cause a curved and painful erection. And you can see from this diagram, there's a fibrous plaque which is labeled. And this is something that the plaque itself doesn't expand. So what happens, the rest of the penis will expand like a balloon, but this plaque does not stretch. So the penis tends to curve around this plaque. Some of the complications from this can include the inability to have sexual intercourse, largely because of the angulation of the penis, difficulty achieving or maintaining an erection, anxiety or stress about the sexual abilities or even the appearance of the penis, and the stress on the relationship with your sexual partner, since intercourse with such a curved penis can cause pain and discomfort to the partner. So what are some treatment options that we have for erectile dysfunction? Moving from left to right, we have oral medications, and we're going to touch on all of these a little bit later on as the slides go through. So we have oral medications, injection therapies, penile implants, vacuum erection devices, as well as urethral suppositories. So let's dive into these ones one at a time. So oral medications are the ones that most people are familiar with. Typically, they work by increasing the blood flow to the penis. It improves the ability to get erections and maintain them. It does, however, require sexual stimulation. So if you take a Cialis or a Viagra, you're not just suddenly going to end up with an erection. If you take it an hour before you go to the library, you're not going to be walking around with an erection. You need to have that type of stimulation. Typically, you take it about 1 to 2 hours before anticipated sexual activity, and it usually works for about 4 hours. Different ones work slightly differently. In this example, Cialis does last a little bit longer. You're not supposed to take more than once per day, and some oral medications, particularly Viagra, can be affected by food. So one of the first things that we do when we're assessing men with erectile dysfunction is, number one, we check to see if they've ever taken these medications in the past. And number two, we check to see if they're taking them properly. Because there's a lot of cases where men don't realize, or they're not told, that you can't take a Viagra and then go out and have a big burger and drink a whole bunch of alcohol and expect it to work. So there's also different ways in which we can prescribe these types of medications. So sometimes you can take them daily, sometimes you can take them on demand about an hour before, or you can combine both of those therapies where you would take it daily as well as on demand. These medications are very effective. Usually in about 50 to 85% of cases, they will give some type of result. Question then is, is the result good enough to achieve an erection suitable for penetration? Almost half of men with erectile dysfunction after prostate surgery will give up on the pills or the pills stop working. And similarly, men with diabetes find that their responses to the oral pills are not as effective as they would like. Now, then another thing to remember with oral medications is the cost of these medications. We do have different sources and no different tips and tricks that we can help our patients to get these medications a lot cheaper than they're normally accustomed to. So that's one of the other ways that we can help you achieve improvement in your erectile function. Some of the side effects include headache, facial flushing, stuffy nose, upset stomach. However, these are few and far between. The main thing that you have to be able to recognize is the last point on the caution part of this slide, where it says you cannot take them with nitrites. And that's nitro puffers for chest pain. You cannot take them together with those two. So men who have to take nitro on a regular basis should not be taking oral Viagra or Cialis or any type of PDE5 inhibitor. Another option is a vacuum erection device. It's a hollow plastic tube that's placed over the penis. You can see a wonderful diagram there in the corner. The pump, which is either hand-powered or battery-powered, can then create a vacuum that pulls blood into the penis. So once the blood is pulled into the penis, there is a very tight band, elastic band, that's used to place over the base of the penis to hold the blood in the penis and allow you to have intercourse. This works along the theory where, in the beginning, where I described the actual physiology of erections, where you have those veins that kind of come along the outside and those drain the blood. What the rubber band is essentially doing is blocking off those veins. So you keep the blood inside the penis, and that allows you to engage in intercourse. Now, it is effective. 60 to 80% of men will be able to achieve an erection with this. However, it does have some pretty significant side effects in my mind. It will block ejaculation, again, because that elastic band the rubber band is very tight. So that'll prevent you from ejaculating. It can cause bruising of the penis. It can cause some penile discomfort. It also causes numbness and coldness of the penis. It's also not typically giving you an erection that's of sufficient rigidity for intercourse. Another medication that is an option is something called a urethral suppository, or Muse. This is essentially an applicator that looks like a lollipop, and then you stick the part that you would hold into the end of your penis, push a button, and it shoots a little pill into your penis. And this essentially causes a medication. This allows the medication that's in the pill to dissolve through your urethral lining into the tissues and allow you to get an erection. It does have some reported success rates. However, we don't prescribe this that often, mostly because of the side effects. There's pain in the penis, pain in the hole where you pee out of, burns. It really is not the most comfortable mode of getting an erection. And it's also very expensive. So I think I prescribed this once in 2-3 years, and that's really about it. Intracavernous injection therapy. Again, this is a medication that you would use to inject directly into the penis. You do this about 5 to 10 to 20 minutes before the onset of erectile function. It works in about 60% of people. And approximately 60% of people were satisfied and continued use. Despite success rates in a study of 254 men, only 20% continued the therapy. The success rate is actually quite high for penile injections. It typically works 80, 90, 95% of the time. The trouble with injection into the penis is exactly what I'm saying. It's an injection into the penis. It's a needle that goes into your penis. It can cause pain. It can be uncomfortable. You have to keep the medication in the fridge. It doesn't allow a lot of spontaneity. But for some men, it is a very well tolerated medication, and they enjoy using it. Penile implant, what that is a surgical procedure to place a device which would allow you to obtain an erection simply by squeezing a pump in the scrotum. So essentially what we're doing is we're placing a pair of cylinders into the penis, a pump is placed in the scrotum, and then a reservoir of fluid is placed into the lower abdomen. And this mimics the physiological effects of an erection. You squeeze and release the pump, which is in your scrotum, that transfers the fluid and allows you to get an erection. It is a very effective surgical procedure. 98% of patients report erections to be excellent or satisfactory. At 7 years, 94% are still in use and free of revision. Now, this surgery, everybody tends to be a little bit nervous about the idea of a surgery, but in many men, we've kind of taken this to the point where this is an outpatient procedure. It can be done in under an hour. And you're basically, if you wish, home that night. And we see you in clinic the next day and just make sure everything is going well. And, you're right back at home. So it's a fast procedure. It's minimally invasive. And it's a fantastic permanent solution to erectile dysfunction. So basically, what are some of the side effects? Some people have reported some pain. Mechanical malfunction can exist. However, this is extremely rare. It is possible because it is a mechanical device that something can malfunction in the device. However, whenever we're putting them in, we're testing it before we put it in your body. We're testing it before we put all the pieces together. We're testing it when we put all the pieces together. And then we test it when it's all closed up. So we're essentially testing that device 3 to 4 times before the surgery is complete, making sure that when it's in there, it's working. Here's an animation which will take you through, and I'll narrate this, the way that the penile prosthesis functions. So what you'll see here is a gentleman with a prosthesis in place. He has the 2 cylinders in his penis, a pump in his scrotum, and that thing beside his bladder on the top is the reservoir containing the fluid. Pumping this pump transfers the fluid from the reservoir into the pump and then into the cylinders. This gets you an erection, which can then be used for as long as you want. Nothing is limiting your ability to maintain this erection other than you pushing that button and causing the deflation to occur. So the nice thing with the Boston Scientific product is this is an auto deflate. So you hold that deflate button for about 5 seconds and then you let go. And that deflates the device, mimicking a physiologically flaccid erection. Very natural, very effective. The penile implant is designed as a permanent solution to the treatment of erectile dysfunction. It's spontaneous. So whereas, we describe pills, we describe a vacuum erection device, injections into the penis, the penile implant is spontaneous. There's nothing that you need to bring with you. There's nothing that you need to refrigerate. You can have intercourse when the mood strikes. Erection can last as long as you or your partner desire. You simply pump it up and you leave it up. There's nothing that's limiting your ability to have an erection. It's entirely contained inside the body. So when people see all these different components, they're worried that you're going to be able to see something from the outside. No one can tell that you have this penile implant inside your body. There's different ways to put it in. You may have a scar over the top of the penis, may have a scar underneath the penis. People can't see that. If you have, if you're looking from across the room, no one's going to be able to tell that you have that. Similar, the pump that's in your scrotum, no one's going to be able to tell that you have a pump in there. It's not evident. The patient and partner satisfaction is very, very high. It doesn't interfere with ejaculation. It doesn't interfere with the sensation. It doesn't interfere with orgasm. These cylinders are placed to simply mimic the enlargement and the flaccid nature of the physiologic penis. So it doesn't interfere with any of the other aspects of erection or ejaculation. Implants have been used for more than 40 years. These are tried, true, and tested devices which have been around for a very long period of time. Nearly 500,000 patients have been treated with penile implants. Insurance coverage cannot be guaranteed. Medicare and most private insurance companies cover penile implants, but individual coverage may vary. Medicare is actually one of the best coverage sources that we have here in Indiana. 80% is covered for the surgery and the facility and everything, typically with Medicare. And when patients have secondaries, that usually covers the rest of the fee. So Medicare is actually a very effective form of coverage. And we have a lot of guys actually waiting until they're 65 simply so that they can get Medicare coverage. At the Men's Health Center, we have a whole system in place to check your insurance to make sure that you are covered. You don't really have to do anything. You simply come into our office. We have an entire team that works with Boston Scientific to make sure that you are covered for the implant, and we'll fight for you to get the best coverage that we can, so that your surgery as well as the implant will be covered. If you have private insurance and a high deductible or an excluded benefit, financial assistance is available. Boston Scientific has a fantastic program that will allow you financial assistance to cover the cost of the implant. Dr. Tatum and I have worked extensively with our surgery center to provide cash-based options, which are significantly cheaper than anything you would get at a hospital, to make this surgery much more within reach for those whose insurance coverage does not allow them to have the implant. Now, penile implants are a surgical procedure. There's risks involved with every surgery. Not everybody is a candidate for an implant. I can't remember the last time I had a patient who was not a candidate for a penile implant, but that's just my experience. There are risks to every procedure, and whenever we discuss the idea of giving you guys a penile prosthesis, we would obviously go through all the different risks that are associated. In summary, erectile dysfunction is a common problem. It can be associated with a multitude of other conditions. There's a wide variety of treatment options in place. At our Men's Health Center, both Dr. Tatum and I are well versed in all of the variable treatment options. We also have two physician assistants, Chris and Kyle, who this erectile dysfunction sphere of treatment is their main wheelhouse. This is what they do. This is what we do. Penile implants offer a permanent solution. Essentially, talk to your partner. Having your partner along with you for the appointments, kind of holding your hand, going through the entire process is very helpful, and has them vested in the outcomes of the procedure. And talk to your erectile dysfunction specialist, who's a prosthetic urologist, of which Dr. Tatum and I are both penile implanters. We do an extensive number of cases. So we're well versed in the surgery, as well as all the different options that we can provide for you. So I'm now going to pass this over to Dr. Tatum. I'm going to stop sharing my screen, and then I'll transfer it over to Dr. Tatum, who's going to talk to us about the incontinence portion. And then after that, we'll move forward with some questions.
Dr. Tatum, who's going to do his best to try and make this computer work. No promises. So as I continue to click buttons here, I just want to emphasize and really highlight what Dr. Kovac said in his presentation. The penile implant is a fantastic, permanent, natural cure for erectile dysfunction. I was talking to a patient today, and he was asking, well, how long has this been out? The penile implant has been out since 1973 and has been just continually innovated upon and improved and improved and improved every single year. And since then, we've come out with Viagra, Cialis, injections, all of that has come out afterwards, and we're still chasing, trying to beat the penile implant. We haven't done it yet. We've got 97, 98% partner patient satisfaction. It's really fantastic. We've gotten to the point where it's minimally invasive, outpatient. We even do some of these cases under local anesthesia, just with some mild sedative, just like you would do for a colonoscopy. We're doing 3 of them tomorrow, I know, in my operating room. And I think it really is a fantastic option for men that want to consider that. But I want to take a moment to really talk about something that's near and dear to my heart, and that is male incontinence. And so if you look here, can you all see my screen? Okay.
I don't think Jason, so. Do you want me to share mine?
No. Well, here, I'll give it one more chance here, and then I'm going to give up. But let's see here. Boom, boom. We're going to share screen. You would think that I would be
Here, let me do it.
better at this as you know. All right, fantastic. So let's go ahead and let's play from current slide. All right, can you guys see it?
Yeah, can you bring it up as like the main picture? Like widen it out.
We'll widen it out. Yes, I can do that. Here, give me a second. Let me pull that out.
It's at the bottom.
And how about now?
Yes, I think that's
fantastic.
Perfect.
All right. I appreciate everybody's patience. So this is near and dear to my heart, the issue of male stress urinary incontinence. And the thing is that if I say those words and they don't mean anything to you and this doesn't apply to you, fantastic. That's awesome. I'm glad that this isn't something that you have to struggle with. But if you are a man that has ever dealt with prostate cancer treatment, prostate removal, you know exactly what it is that I'm talking about. Male stress urinary incontinence is the leakage of urine whenever you cough, when you sneeze, when you don't want to leak. And if you're someone who's had to experience this, it can be devastating. You know, we know that as many as 50% of men who undergo prostate removal are going to experience some sort of urinary leakage afterwards. I'm involved with this program, as is Dr. Kovac, of counseling our men that are undergoing prostate removal. They are doing the right thing. They are going to get cured of their prostate cancer, but we counsel them that urinary leakage is possible and is likely to an extent. Now, the caveat that I will give to that is that although every man will leak after prostate removal initially, okay, the vast majority of men will not leak long term. But if you are one of those men, you deserve to have that evaluated. You deserve to have that cured. So let's talk about this process of urination. How does it work? It's not something that we ever think about until it goes wrong. So our kidneys that sit up here in the top of our abdomen are responsible for filtering blood, okay? And what happens is they filter blood and all of the waste products, everything that we don't need gets turned into urine. That travels down to the bladder, which fills with urine, stores it, so we're not leaking constantly, okay? And then once the bladder gets full enough, you have a relaxation of the sphincter muscle, okay? There's actually two quote unquote sphincters. There's the one that you can consciously squeeze and you can tighten to pinch off your urine stream. But there's also what we call an internal sphincter or a passive sphincter, which is really just the resistance that is provided by the prostate itself. Okay. And you'll see where this is important later. Now, we know that prostate cancer treatment is going to be the leading cause of stress urinary incontinence. However, there can be other causes as well. So men that have been in certain sorts of car accidents, pelvic fractures, men that have had certain neurologic disorders in the past, there are other causes and those men deserve to be treated. But again, if you've had your prostate removed, you know exactly what I'm talking about. So why is urinary incontinence important? Well, it's important because it can drastically affect a man's quality of life. And so if you just hear about it, if you think, oh, well, you know, if someone maybe just has like a small pad in the front of their underwear, and maybe they change that once or twice a day, is that really that big of a deal? Well, when you're that man and when you're constantly trying to monitor how much water and how much fluid do you drink, you know, do I pick up my kids? Do I go outside the football around?
Is that me?
More about this pathophysiology, which is our fancy doctor's word for you know, how things work or how they don't work. So when you remove the prostate, you remove that internal sphincter, that mechanism to kind of start and stop the urine stream, okay? What provides a little bit of extra resistance. Now, most men will still preserve that conscious sphincter, so that muscle that you can kind of squeeze and pinch your urine stream off with. But all of a sudden, you're asking that external sphincter to lift a lot more weight than it's used to doing, and that's why a lot of men can end up having some leakage after prostate removal. And if they ever need, let's say, radiation to treat their prostate cancer further, that can really exacerbate the issue. So Up to 9 to 16% of men can have significant leakage a year after treatment, and that's an issue, okay? So, as we mentioned before, almost everybody will leak immediately afterwards, okay? But long term, okay, it can be anywhere from, we've had numbers quoted from 9 to 16. Some people will say 2%. But what I think is a really important number to know as a man is that 94% of men who will regain continence, okay, guys who are going to recover, will have done so by 6 months. And so if you're somebody and you're recovering from your prostate removal and you're still at that point, maybe 6 months, and you still haven't regained it, maybe it's time to come talk to somebody and to maybe think about getting something done to get it fixed, okay? So let's talk about short-term options, right? Okay, let's say you're immediately after prostate removal. Okay, what can you do to try and mitigate this? Well, you can control how much you drink. You can control how you move and how you lift things. Pelvic floor physical therapy is a fantastic option for men immediately afterwards as they're learning how to control those muscles better. I think that that's really important, okay? But then you get into what we call coping. And coping's not a great place to be. Coping is when you're wearing pads, you're wearing diapers, or what you see there, an external catheter. You know, when I was in training, you know, in residency downtown, we called them Texas catheters. That's not a treatment, okay? And that's really not a way to live, but it can work temporarily, okay? The challenge is that a lot of those things aren't really covered by insurance. Some people can use maybe an HSA, but which is a health savings account, for those of you who don't know that acronym. But a lot of people are on a fixed income, and spending any amount of money on diapers and pads is not just embarrassing, it's not a financial possibility. And the truth is that we have fantastic cures to fix people's urinary leakage, cures that are covered by Medicare. And men don't have to live with this. They really don't. Okay. Now, let's talk about those long-term cures. Okay. There are really two. There is what we know as the male sling. Okay. All right. And then the artificial urinary sphincter. And they differ significantly, and they're made for different patients. All right. So for some patients, okay, they can control their urine stream fairly well. But when they get too full, they leak when they cough or sneeze. It's not constant. It's not a constant stream, but it's enough to affect their quality of life. They go to bed at night and they wake up and their underwear is dry, okay? If they go to the bathroom to urinate, they can start and stop their stream. They can control their sphincter somewhat, but it's just not strong enough in order to hold urine the way that they need to and to stay dry. These are men that are maybe leaking 1 pad per day, 2 pads per day, 3 pads per day, okay? These are men that benefit from a procedure called the male sling, where we can actually lift and elevate the urethra. By doing that, the sphincter that they still have and is still working to an extent just doesn't have to do as much work. It doesn't have to do as much heavy lifting, okay? And what's nice about this is that once we place this and once it settles in, those guys never have to think about anything again. They don't have to press anything. They just urinate, and all of a sudden they're able to hold their urine so much better than before. We just did 2 of these surgeries on Friday. Gentlemen went home the same day, came back on Monday for a quick checkup to make sure they're doing all right, and they are doing great. And they are so much happier now that they've gotten this taken care of. All right. Now, what happens if a man, let's say, gets his prostate out and leaks a fair bit? And what if that doesn't get better? And what if that man also had radiation and has significant urinary leakage afterwards? These aren't men that are leaking 1 pad a day, 2 pads a day, 3 pads a day. These are men that are going through 4, 5, and 6 pads per day. Okay. These are men that can't start and stop their stream, and men that are not dry at night. Okay. We can still help these men. Essentially, their sphincter, that muscle that pinches off the urine tube, isn't working anymore. And we need to replace that. And we do that with something called the artificial urinary sphincter. What this is a device that can pinch off the urethra itself. And then on command, when a man wants it to release and he wants to urinate, he presses a small button that we hide underneath the skin and the scrotum, okay? And we're going to talk about this a little bit more. So going back to the male sling, benefits, much like the artificial urinary sphincter, minimally invasive. What I like about the Sling is that my patients don't have to think about it once it's been placed. Again, these are made for different patients. So it's not like one is better than the other. But if I can find a patient and if I can evaluate him and he's a good candidate for the Sling, I love it because it's one and done and a fantastic solution. Okay. Now, the artificial urinary sphincter is also wonderful. And this is designed for those patients who are in a different place than those Sling patients. These are men, they need something that can go the extra mile, and the artificial urinary sphincter can absolutely do that. Now, the artificial urinary sphincter is a little bit more complex, and it does require men to press that button, but it mimics the natural motion and the natural action of that sphincter, and it's really quite elegant. So if we go here to this animation, I'll go ahead and I'll play it. You'll be able to see how the artificial urinary sphincter works. All right. And so we'll go through here through our little disclaimer. And you can see that everything is internal, nothing is hanging out. And you can see that balloon wrapped around the urine tube, wrapped around the urethra. A man just squeezes that button, and all of a sudden, that balloon releases, relaxes. A man is able to empty his bladder, and then it automatically cycles back on and pinches off that urine stream. So all of a sudden, he can go back about his day. If he was at a urinal standing next to another man, you would never know that he had anything done. And that's what I like about all of our cures that we're talking about tonight. They are personal and they are private, okay? So if you are someone that is struggling with urinary leakage, I encourage you, don't just live with it. We have cures, we have solutions, okay? If you go to fixincontinence.com, you can learn more. You can answer some questionnaires there, or you can just make an appointment with us and we'll have our contact info at the end of this presentation. So again, let's talk about side effects as we do for all procedures. Every choice, everything we do in life has side effects, okay? And medical procedures are no different. So we're operating around the urine tube. There's a chance that we could injure the urine tube, okay? The artificial urinary sphincter is a mechanical device. That means that it can malfunction. You might need it replaced, all right? That's okay if it does. We can remove it, we can replace it, we can revise it, but it's something to keep in mind. Infection is always the concern of a prosthetic surgeon like myself. If you get an infection in an implanted device, antibiotics don't always cover it. Sometimes we have to remove that infected device, wash things out, and replace it, okay? That being said, the risk of side effects with either of these procedures is exceedingly low and is even lower in the hands like doctors like ourselves who just do a lot of the surgery. It's not because we're special or amazing or anything like that. It's just we are very fortunate to be part of a large group where we can be dedicated specialists and get a lot of experience in taking care of these patients and taking care of these solutions. So insurance coverage, like with a penile implant, insurance coverage can't be guaranteed. I'll be honest though, the insurance coverage for these interventions is fantastic. These are one of the few things that's even covered by Medicaid. It's covered by all major insurers. I will say this, knock on wood, I have never had a patient decline for this when they've had a medical indication for it, but we always check and ensure coverage beforehand because that should not be a headache that any patient deals with, okay? So in summary, male stress urinary incontinence is a known side effect of prostate cancer treatment in addition to some other conditions, okay? It's the involuntary leakage of urine when you don't want to, when you cough or when you sneeze. There are coping mechanisms. There are things that you can do to try and put a Band-Aid over it. But when it comes to a cure, we have fantastic options in the form of the male Sling and the artificial urinary sphincter. And when it comes to deciding what is the best option for you and how can you cure your urinary incontinence, that's where we come in. And we encourage you to seek out treatment, make an appointment with us, and get yourself checked out. So if you want to learn more, we encourage you to visit our website. We are very lucky to have our own website. So we have our General Urology of Indiana website, urologyin.com. We have our own men's health website, completely dedicated to just these issues at menshealthindy.com or Indy Men's Health. So you can go to INDYMENSHEALTH, indymenshealth.com, and you can visit our website. You can call us at the number listed there on your screen, 877-362-2778. That's 877-362-2778. And you can request a consultation with either myself or with Dr. Kovac.